inflammation, a new frontier of medicine. What is inflammation and why do we call it a new frontier of medicine? Inflammation as a concept has been known for over 2,000 years. The word inflammation comes from Latin inflammare, which is to set on fire. Now, inflammation is characterized by heat, redness, swelling, pain, resulting in a loss of function. But it is a defense mechanism for either injury or infection. So it's an important biological function that we all need and we have whenever there is injury or infection. So why do we call it a new frontier? I think I can make a case by showing you the recent 2-month-old issue of Science, which is a very respected journal in science, which talks about insights of the last decade. One of those insights is inflammation. And when you look at the article, it explains what we know about inflammation and why some recent findings, recent research has shown why inflammation is important. The first paragraph, which I'm sure you can't read, I can't, so I magnified it. It says, not long ago, inflammation had a clear role. It was a sidekick to the body's healers, briefly setting in as immune cells rebuilt tissue that was damaged by trauma or infection. Today, inflammation has hit the big time. Over the past decade, it has been widely accepted that inflammation is a driving force behind diseases that will kill nearly all of us. Here, inflammation wears a grim mask, shedding its redeeming features and making sick people sicker. So what is important to bear in mind here is that inflammation is an essential response to infection and injury. As long as it's controlled, it's good, but it is the loss of control in the inflammatory response that can cause diseases. What diseases can it cause? A short list of diseases that are caused by inflammation are given in this slide. Acute pancreatitis and repeated attacks of acute pancreatitis can lead to chronic pancreatitis, sepsis, burn injuries, hemorrhagic shock, arthritis, including rheumatoid arthritis and gout, atherosclerosis, ischemic heart disease, asthma, allergies, cancer, diabetes, Alzheimer's disease, inflammatory bowel disease, cellulitis. They all have an inflammatory component, and yes, inflammation is an important factor in all these diseases. My personal journey of research on inflammation started in 1995 when I went to Harvard Medical School and I started working on acute pancreatitis. And as Peter mentioned earlier, from there I went to University of Liverpool in the UK, and I was a little more than 8 years I was at National University of Singapore, and last year I've started working here at University of Otago Christchurch. The diseases that I have been mostly interested in and I will be discussing today are acute pancreatitis, sepsis, burn injuries. There are some other diseases in which I have some interest, and although I'll not be talking too much about them, except arthritis briefly at the end, are hemorrhagic shock, atherosclerosis, cancer, and diabetes. So these are all diseases that we have been working on. But why acute pancreatitis, sepsis, and burn injuries? Let's look at acute pancreatitis first. Now, when we say acute pancreatitis, it is inflammation of the pancreas. It's a common clinical condition in different studies. It has been shown to affect 300 to 700 per million population. The primary causes are gallstones and excessive alcohol consumption. but other causes include hyperlipidemia, that is too much fat in the blood, infection, it can be after surgery or trauma. In some cases, it can be hereditary. In many cases, it's a mild condition, but in 20 to 25% of cases, it can be severe with an overall mortality of 8 to 10%. There are significant costs associated with this disease, and there are data from the US. In the US, direct annual healthcare cost for acute pancreatitis is $2.2 million. Sepsis, which is another common and serious medical condition caused by a severe systemic infection leading to a systemic inflammatory response. Now, systemic inflammatory response we find in pancreatitis as well as in burn injuries, and that, especially the severe cases, and in that situation, we see damage not only to the local organ where there is a primary attack, but also in distant organs because of overactive inflammatory response, such as lungs or kidneys that are affected in severe acute pancreatitis or in severe burn injuries. Sepsis is a leading cause of morbidity and mortality. In the US, there are 2,400 cases per million population, and in hospital deaths related to sepsis are about 450, 440 per million population. There are data from New Zealand and Canada, New Zealand and Australia, where it has been shown that 12% of ICU cases have severe sepsis. Now, that was a multicenter trial which had patients from many centers in Australia and New Zealand, including Christchurch Hospital. The costs associated with sepsis are $17 billion in the US. Burn injuries, which again are common and serious in that more than the population of New Zealand receives medical treatment in the US every year. It's a very significant number. Fire and burn-related deaths per year are 4,000 in the US, and hospitalizations for burn injury per year are 40,000. In the US, direct annual healthcare costs for young population of 0 to 19-year-olds is $2.1 billion. Now, this is a population that is more susceptible to burn injuries and the other population being the elderly. The very young and the very elderly are more at risk of burn injuries and consequences of burn injuries. And it's not just the direct healthcare costs that we have to keep in mind. It's also costs that are, in addition to that, loss of productive work time, that adds costs, that adds to costs. And then for anyone who's ever had a close one, a parent, spouse, or any close family member with a serious illness would know that it affects, there is the cost in dollar terms, but also human cost that you cannot measure in dollars. So it's important that we do research on these diseases to try and find good markers of diagnosis, good markers of prognosis, that is predictors of severity. Also, we look for potential treatment approaches or therapeutic targets for these conditions. That takes us to hydrogen sulfide. Now, it's a very simple molecule of 2 hydrogen atoms and 1 sulfur atom. What is hydrogen sulfide? It's a gas that causes the smell of rotten eggs. Hydrogen sulfide when you think of hydrogen sulfide, you think of volcanoes, because that's where this gas comes from. You think of, volcanic ash. It's an environmental pollutant. It's an industrial pollutant. But the other side of hydrogen sulfide is also that you see it in hot water springs. There are deep sea bacteria that do not have access to oxygen. They are anaerobic bacteria, but they use sulfur as for their life instead of oxygen. And Rotorua, if you go to Rotorua, which I don't know how many in this audience have been to, but you can smell hydrogen sulfide in the air. So hydrogen sulfide, what is known about hydrogen sulfide is that it is a colorless toxic gas with a strong odor of rotten eggs. It causes, at higher doses, it causes intoxication of the central nervous system, inhibition of the respiratory system. The question is it produced in the body? And yes, it is produced in the body, because when we consume proteins, they are made of amino acids. Amino acids are the building blocks of proteins. One of those amino acids is cysteine. And when cysteine is metabolized or broken down, with the help of this enzyme, cystathionine gamma lyase, or CSC, we see that H2S is formed. Now, it's important to keep these concepts in mind, because we are going to come back to them over and over again during the course of this presentation. Now, cystathionine gamma lyase, or CSC, is responsible for the production of H2S, and it can be inhibited by this chemical called propagyl glycine, or PAG, which binds to CSC and inactivates CSC. So we have H2S formation with the help of CSC, and PAG, which would inhibit CSC by binding to it, would inhibit H2S formation. So it is produced in the body. And when we started working on it, we didn't know if it was produced in different organ systems. We knew that it was produced in the liver. We are not very clear about its function, and we were definitely not clear about its role in inflammation. And that's what we have tried to do in the last few years. And when I started looking at H2S in inflammation, my first interest was acute pancreatitis. Now, in this work, I was helped by Fei-Ling Wong, who was a former research assistant in my group. And if you're wondering, Fei-Ling is this. We do take pride in training our young scientists, but this little one is still too young for that. So we took 3 mice, got their pancreas, and looked at whether or not there was expression of CSC in the pancreas. No one knew that whether or not CSC was produced in the pancreas. We found that, yes, it was present in the pancreas. It's one thing to have an RNA for a protein. It's another thing to have a protein that has a function. So we looked at hydrogen sulfide synthesizing activity and whether or not it could be blocked by an inhibitor. And we found that this is what was happening. When we looked for what happens when you have pancreatitis, we found that hydrogen sulfide levels in plasma were increased in acute pancreatitis. So we started off with whether or not we have the system to produce H2S in the pancreas. Yes, it is. Is it active? Yes, it is. What happens in pancreatitis? H2S goes up. Does it have any function? And how do you know whether or not it has any function? You see what happens when you block H2S synthesis in pancreatitis, and that's what we did. So in pancreatitis, you see that H2S is formed with CSC action, and we see that there is pancreatic injury and lung injury because of, as I said, systemic inflammatory response. When we blocked CSC activity with PAG, there was less of H2S in the system. You can see smaller font, less H2S. H2S formation is inhibited, so there is a protection against pancreatic and lung injury. So these results showed to us that H2S acts as an inflammatory mediator in acute pancreatitis and associated lung injury and could be a potential therapeutic target. Now this was something significant because it's not every day in science that you discover or identify a new mediator. And we were obviously pleased that we had identified a new mediator of inflammation. We were able to publish this paper in a good scientific journal, so it was accepted by our peers in science. And to make things better, that made us even more famous because we were covered by the national press. So you're obviously pleased that you're covered by national press and you have your pictures in newspapers and you're happy, and then the next day you go back to the lab and do some more work. We started looking at hydrogen sulfide in sepsis. And this work was done by my former PhD student, Yang-Hui Lee, who found that with PAG treatment, there was a significant 40% improvement in survival in mice. So it was a significant finding because there was, if without PAG, you had 100% mortality by 4 days, and with PAG treatment, that is when H2S synthesis was inhibited, there was a significant protection, 40% survival was improved, and that's 40%